For joining us today, everyone. I'm Erica Hartquist, Media Public Information Officer with the Oregon Health Authority. Today, we're providing an update on the very latest developments in the COVID-19 pandemic here in Oregon. Please mute your microphone on your computer. That'd be very helpful. Joining us today are Patrick Allen, Director of the Oregon Health Authority, Fairborz Pakseresht, Director of the Oregon Department of Human Services, Kathleen George, Council Member for the Confederated Tribes of the Grand Ronde and a Spirit Mountain Casino Board Member, Colt Gill, Director of the Oregon Department of Education, and Dr. Dean Sidelinger, our State Health Officer, who will answer questions as well. This is a friendly reminder to please mute your audio again and use the raise your hand function right there, and you'll be added to the queue to ask a question. You will be granted permission today to record one by one individually as our admin staff goes through this. So hopefully that works for our broadcast media friends. This is an opportunity again for members of the media to ask questions. And we also want to point out the public is always encouraged to ask questions during our Facebook Live events. Now let's get started. Director Allen.
Thanks, Erica. Good afternoon. I'm Patrick Allen, Director of the Oregon Health Authority. We're here today to update you on steps our state is taking to help Oregonians protect themselves during the Omicron surge, prevent our healthcare systems from being overwhelmed, and help schools navigate this difficult time. As you heard, I'm joined by Fairborz Pakseresht, Director of the Oregon Department of Human Services, Kathleen George, a Council Member for the Confederated Tribes of the Grand Ronde, Colt Gill, Director of the Oregon Department of Education, and Dr. Dean Sidelinger, our State Health Officer. The Omicron variant continues to tighten its grip on Oregon. Today, we're announcing 9,797 new cases. As of yesterday, our 7-day moving average of new cases was 7,618, a 28% increase over the previous week. For the week ending January 9th, Oregon recorded an astounding 47,272 cases, which was 3 times higher than the previous pandemic records and 6 times higher than was reported just 2 weeks ago. Every day brings more hospitalizations. Today, there are 777 people hospitalized with COVID-19, 21 more than yesterday. Our statewide ICU capacity is now at 5%. Hospitalizations are more than 45% above the past week. They've increased more than 70% since the start of the new year. In light of these numbers, I'd like to take some time to talk about COVID-19 testing. Since the first days of the pandemic, we've known that testing is essential to slow the spread of COVID-19. But the United States has struggled to deliver adequate testing. For most of the pandemic, testing's been in short supply. Today, a COVID-19 test remains a scarce commodity across the United States, and it's no different in Oregon. I know many people are worried and frustrated because timely tests are hard to come by unless you have the flexibility and patience to wait your turn in line at a testing site. I hear it from friends, family, even coworkers. Many people in Oregon are having to wait several days for a testing appointment at a health clinic or a pharmacy. You may have to wait a couple of weeks for the test you ordered online to arrive. Those delays don't help if you're feeling sick and you want to know if you could be a risk to your family or if you can safely go to work. These frustrations are real and they may be with us for weeks. But while it may seem like COVID-19 testing is impossible to find, Oregon's testing volume has never been higher than it is today. During the first week of January, testing volume nearly doubled over the previous week. Over the past 7 days, Oregon has recorded more than 300,000 COVID-19 tests. According to the Kaiser Family Foundation, Oregon ranks 16th in the nation in daily testing volume with 4,620 tests per million people as of January 10th. I want to make that point again. Oregon's testing volume has never been higher, and our testing volume will only increase as millions of at-home rapid antigen tests we purchased continue to arrive in our state. We've been asked the question, if Oregon ordered 12 million tests, where are they? How can I get one? Last week, we received 589,680 test kits, over 1 million tests, which we prioritized for critical state infrastructure, hospitals, and schools. We've sent 567,810 to 37 hospitals across the state, sending out over 96% of the tests we've received. We've continued to receive more tests since then. Over the past weekend, 5 more shipments that contain nearly 1 million more test kits headed toward Oregon. Yesterday, 2 of those shipments arrived, containing 393,120 test kits. In total, we've received 982,800 test kits to date. The manufacturer tells us the same number of test kits will arrive in Oregon within the next 7 days. We expect to have all 6 million test kits in the state by the end of January. We're currently supporting 10 high-volume vaccine sites in Clackamas, Coos, Deschutes, Douglas, Lane, Jackson, Marion, Multnomah, Polk, and Yamhill counties. 6 of those sites have testing available, and we're working to add testing to the remaining sites by next week through partnerships with Curative and with the federal government. Some of those sites are indoor walk-up vaccine clinics. Others are outdoor drive-through clinics. Most of these vaccine clinics don't require an appointment, but check to see if you need an appointment to get tested. On Saturday, our partners at the Confederated Tribes of the Grand Ronde will open a high-volume vaccine site at the Spirit Mountain Casino, and testing will be added there next week. We've also requested 3 additional federal testing sites in the Willamette Valley. Throughout January, we're offering testing and vaccination clinics at markets and other locations serving people in the Latino, Latina, Latinx community so we can reach this hard-hit population. I want to be very clear about the decisions we've made in allocating our 6 million at-home rapid antigen tests. We're distributing these tests to hospitals and schools, local public health authorities and tribal governments, community-based organizations that serve communities that have been disproportionately impacted by the pandemic, Head Start programs, organizations that serve agricultural workers, and organizations that serve the homeless. Our test distribution strategy is grounded in fairness and equity. We're prioritizing the 6 million test kits we've purchased for organizations serving people who are most exposed or most vulnerable to COVID-19, or people who have less access to a test. We're not offering the limited online direct-to-consumer opportunities some other states have provided. Instead, we want to make sure tests are available to people like a nurse in the hospital, a grocery store clerk who has limited, if any, sick time, a Head Start teacher whom a dozen families entrust their children to each day, a worker in a seafood processing plant who's working alongside others on the line, all of whom have families that depend on their hourly wages. Again, Oregon is testing more people than we have ever tested before. We're outpacing most other states in our current testing volume, but as Omicron rips through our communities, testing demand is also running rampant. If we're going to keep Omicron from disrupting our economy and our healthcare system, we need to target our testing resources in ways that are smart and fair. Sky-high cases mean that demand for tests will remain sky-high for several more weeks. If you or someone you know is not feeling well, but you're at low risk, you're not a senior, you don't have underlying conditions, you're not immune compromised, here's what you should do if a timely test isn't at your fingertips. Assume your symptoms are COVID-19. Isolate yourself from others for 5 days. Wear a mask. If after 5 days you don't have a fever and your symptoms are better, you can return to your normal activities while being careful to continue to wear a well-fitting mask. What should Oregonians do if you get a positive test result? Yesterday, the Oregon Health Authority announced a new website and hotline as a way for people who test positive for the virus to report results for an at-home test kit or testing provider. People using the new Positive COVID Test website and COVID-19 case support hotline at 866-917-8881. Again, that's 866-917-8881. Can complete an online survey linked from the web portal to report their positive case or get help completing the survey through the hotline. They can also get information on isolation and other ways to keep themselves and those around them safe while they recover. The launch of the services follows an OHA decision to revise our COVID-19 case investigation guidelines and shift to an opt-in model of case reporting. In the face of rapidly rising Omicron cases, Public health authorities will focus less on interviewing individual cases and conducting contact tracing, and more on outbreaks in high-risk settings, such as those in congregate care, healthcare, K-12 education, and food processing industries. Self-reported tests that come into the hotline will be included in our daily case counts. Self-reported results from the website will be reviewed by epidemiologists to determine if they meet the presumptive case definition. 2 years into the pandemic, this reporting change is part of a broader shift away from case counts as the primary yardstick of the pandemic. We'll still report daily case counts. We'll still gauge the overall trend in newly diagnosed cases. But we know our daily case counts are missing many at-home test results. And in the face of the highly transmissible Omicron variant, case data is also missing many undiagnosed cases as well. And to be completely transparent, we're likely approaching the maximum capacity of our testing system to identify cases. Instead, hospitalizations and deaths will continue to represent our most reliable and significant metrics. And as it's been since day one of the pandemic, protecting Oregonians from these events will remain our primary focus and our overriding imperative. Here are some of the latest steps OHA is taking to support hospitals amid the Omicron surge. We're working with the Oregon National Guard to dispatch approximately 1,200 National Guard members to hospitals to provide non-clinical support services, freeing up resources for other points of care. On behalf of all Oregonians, I want to express my deepest gratitude to all the Guard members who have stepped forward to support Oregon in countless ways, at the cost of untold personal sacrifice in their own lives throughout this pandemic. OHA has placed 619 clinicians on site at hospitals, long-term care, vaccination sites, and other healthcare settings through our existing contracts. By late next week, one of our contractors, Jogan Health, is expected to have formed a rapid relief pool of 200 healthcare professionals who will stand ready to be deployed to facilities that are on the brink of being overwhelmed. Public health officials are working with Jogan to add an additional 300 medical personnel in the following weeks. State health officials have executed a new contract with Maxim Health, which is working to staff about 700 clinical positions in health systems and long-term care facilities. We're also in the process of finalizing contracts to bring in another 600 LPNs and RNs, which will be developed to long-term care health facilities throughout the state. But we all have a responsibility to protect ourselves, the people we care about, and the healthcare system we all depend on. The best ways to do that are to get vaccinated, get boosted, and wear a mask. On December 17th, Governor Brown called on all eligible Oregonians to get a COVID-19 booster shot and called on 1 million Oregonians to get boosted by the end of January. State officials got ready to boost them. Together with our partners, we launched 10 new mid-capacity vaccination clinics, deployed FEMA mobile vaccination teams, and coordinated vaccinations with nursing homes and other long-term care facilities. As of January 12th, 323,130 Oregonians have received a booster. That means Oregon needs 676,870 people to get a booster to reach the goal and make our state safer from the Omicron variant. Oregon currently ranks 13th in the nation in our rate of booster doses. As of yesterday, 42.5% of the eligible population has received a booster. Oregon's been successful in boosting seniors, our most vulnerable population. As of yesterday, over 450,000 seniors, or 71%, had received the protection of a booster. To date, nearly 9 in 10 long-term care facilities have had a booster clinic. We're continuing to push facilities that have yet to schedule a booster clinic to get vaccinators in their doors. It's no secret we're behind the pace we need to reach our additional 1 million booster goal. Right now, we're likely to hit about 650,000 new boosters by the end of the month. That's a big total, but we're still aiming higher. At a time when so many people are desperately seeking a COVID-19 test to find out whether they're infected with Omicron, Oregon vaccinators stand ready to help you take the most important step you can to protect yourself and the people around you. Get a booster dose. Now, let me turn it over to Councilmember George. And you're on mute, Councillor George.
Thank you very much. Thank you, Director Allen. This will be the third COVID protection clinic that the Grand Ronde Tribe and Spirit Mountain Casino has hosted on site. And we have been so pleased to partner with the Oregon Health Authority to help people protect themselves and their families. At this upcoming clinic, all testing and vaccines will be administered by the Oregon Health Authority, and we are providing the space and the signage. Health and safety has always been a main priority for our tribe and our employees. And like so many others, our tribal community has suffered hard losses due to this deadly disease. So in addition to these 3 clinics at the casino, our tribal clinic has gotten out more than 22,000 COVID vaccines and hosted 2 additional vaccination events at our Wood Village property. Due to the recent spike in cases, we were just so happy to be able to hold another partnership event with the Oregon Health Authority to help provide these services for anyone who needs them now at this difficult time. Our tribe always works to be a good community partner, no matter the issue or the need. During the fairly recent wildfire crisis, and we provided meals, lodging, and space for wildfire crews. The casino provided lodging and RV spaces for those who had to evacuate during the wildfires. And our Spirit Mountain Casino also serves as a landing pad for Life Flight due to our rural location. But when planning this clinic, a priority was placed on making testing available. We understand that tests have become truly scarce in some communities. So working with Oregon Health Authority, we really want testing to be available to anyone who needs it with the vaccines and the boosters. So we are hoping anyone who needs testing or vaccines comes out to get these important protections. This is the kind of work we need to do together. We need to partner with everybody who wants to fight this disease with us. And we cannot give up, and we want to help every single Oregonian protect themselves and their families. Thanks.
Thank you very much. And now we would love to hear from Fairborz Pakseresht, Director of the Oregon Department of Human Services, with some remarks.
Thank you, Erica. Good afternoon, everyone. Again, Fairborz Pakseresht, Director of Oregon Department of Human Services. The Oregon Health Authority and Oregon Department of Human Services have worked closely together throughout the pandemic to prevent COVID-19 infections and ensure not only hospitals, but all levels of care and support are safe and available to Oregonians we serve. When outbreaks occur, our 2 agencies are responding together so we can better coordinate protecting Oregonians and also eliminate duplication and redundancy at a time when workforce shortage is impacting all of us. We've learned together, and our response has evolved over time. We've adapted to meet the demands of each new surge and the strain that each variant of this virus has put on people and care providers. We've also built cross-agency teams throughout the pandemic that now have depth and experience. During the current Omicron surge, our teams are collaborating to find new ways to use our resources to help both facilities and in-home care providers that serve Oregonians who receive ODHS services. We've also assisted hospitals with finding care options for patients that were ready for discharge, whether or not they were receiving services from ODHS. For the current surge, we established a network of statewide short-term care discharge units that are under contract in a licensed long-term care facility to serve individuals that require nursing home level of care after they leave the hospital. Our staff manage the referrals and provide hospitals with discharge assistance for individuals. One thing the pandemic has taught us all is how interconnected our systems are. A shortage of hospital beds, for example, is exacerbated when other care options, including in-home care and long-term care, are also under severe strain. So while focusing staff support on hospitals is absolutely needed, it doesn't fully address the problem. Oregonians can't leave the hospital if they have no options for the care they need after they are discharged. In turn, long-term care facilities may have beds available, but if they're experiencing a staff shortage, they can't fill them since they can't provide adequate level of care. Our response to the Omicron surge is based on what we know about the supports and resources that have the highest impact in helping meet the staffing and capacity needs of all care providers. To that end, together, we've made significant investments in resources and rolled out multiple initiatives that aim to prevent a regional care crisis and to respond more effectively when crises occur. These initiatives, and I list them for you, include providing temporary staffing support. We are securing 500 contracted clinicians from out of state to strategically deploy to support our long-term care facilities to preserve capacity so hospitals can discharge individuals for short-term recovery to a skilled nursing facility and to address workforce shortages to maintain patient safety. Currently, 20 long-term care facilities, 37 group homes, and ODHS stabilization and crisis units, which serves people with intellectual and developmental disabilities, have active staffing support. With national shortages of direct care staff, we know we'll still have gaps, and we'll do our best to close those gaps. We are monitoring bed capacity. We survey long-term care facilities about their bed and staffing capacity by region so that we can get out in front of an emerging crisis. We provide specialty care units. We have set up dedicated care units to serve Oregonians who may otherwise linger at a hospital because they have no other option. These include 6 short-term care discharge units with 150 beds and 7 COVID-19 recovery units with a total of 188 beds to care for Oregonians who are recovering from COVID-19. We are also ensuring access to boosters. We know vaccines and boosters are our best opportunity to prevent infections, serious illness, and hospitalizations. To that end, we are assisting facilities as well as Oregonians who receive in-home care with COVID-19 vaccine and booster shot clinic opportunities. Combined, we believe these initiatives give the state the ability to be flexible and address needs at a regional level as they arise. The goal is to best deploy resources to avert a hospital bed shortage and prevent as many infections as possible. With that, I'll turn it over to Director Colt Gill from Department of Education.
Thank you, Director Pakseresht. Good afternoon, everyone. I think I am your last speaker before we open up for questions, so I'll try to be brief for you all. Last week, I reiterated our North Star for this school year, and that is to safely hold school in person all day, every school day for every student all year long. Another week into Oregon's Omicron-driven COVID-19 surge, and we have seen a few dozen public and private schools cancel a day or two of instruction.
Perdón, Mark, están hablando los dos. Gracias. Puedes hablar tú, Mark.
You're muted, Erica. Okay. I'll continue there. Sorry about that. Another week into Oregon's Omicron-driven COVID-19 surge, and we have seen a few dozen public and private schools cancel a day or two of instruction or move temporarily to short-term distance learning. These moves have happened due to staff shortages that were exacerbated by Omicron-related staff illnesses, isolations, and quarantines. These challenges have impacted schools in urban, suburban, and rural parts of the state. Omicron is a statewide challenge for us as it continues to surge across Oregon. The surge is predicted to continue to increase for the next 2 weeks before peaking. Oregon is home to over 1,300 schools. Only a few dozen schools have had to make a temporary move away from in-person learning. Holding school in person remains the highest priority for our state and for everyone in each of our schools. We believe most children learn better when they're taught in person. We know that children and families rely on schools to provide a caring and safe environment, and many of our students need access to the solid breakfast and warm lunch that's provided at school. For parents and families, we know that they need consistency. They rely on school to ensure that they can go to work and support their family. I've checked in with many teachers, superintendents, and others working in our schools over this last week. Our educators are giving us their all in very trying times. We have asked a lot of our educators, of our students, and our families these past 2 years, and the current surge is pushing a stressed system to its limits. But the potential for better days, I believe, is in sight. In Oregon, we're at our strongest when we pull together and unify to tackle our challenges. We can and will get through the current surge, but I believe that we can do better than just get through. We can do better if we can surface our deepest community values of Oregonians. Then we can muster the extra effort in this time to give one another a hand, even just to offer a smile or share a kind word, or to really dig in and work in unison. If we can do this, we will keep more of our schools operating in person, helping more of our children thrive, and ensuring our families have what they need to succeed. Together, we must set our COVID fatigue aside and again, reestablish and reemphasize all the layered mitigation protocols that we know work, even with Omicron. That means getting vaccinated and boosted to avoid quarantines. It means wearing a properly fitting mask and maintaining physical distancing to limit spread. And it means implementing in our schools testing, quarantine, and isolation protocols that keep everyone in the community safe. Even with high community spread, consistently implementing these practices keeps COVID-19 from spreading in structured school environments. But we have to fully commit to ensure that this works with the incredibly contagious Omicron variant. Finally, please know this, that in my many discussions with school superintendents over this last week, it is clear that safety of our students, safety of our staff, and safety of the families that they return to each day in these difficult times are at the forefront of their decision-making. They are considering both the physical and mental well-being of everyone in their care. Having to transition, even temporarily, to short-term distance learning is the last option on their list. It is only considered when they do not have enough staff to operate safely or if community spread requires it. If they transition to in-person learning, it will be disrupted to everyone in their system, and it will also be temporary, much like the current Omicron surge is for Oregon. Thank you for doing what you can to help us reach our North Star for kids this year. Let's keep our school doors open. Now we can take questions.
Great, thank you so much, Director Gill. Okay, our first question comes from Ted Sickinger with the Oregonian. Go ahead, Ted.
Hi, yeah, thank you. I was hoping Director Allen could reiterate the numbers of new clinicians, nurses, et cetera, under those specific contracts. And are those different from the one that the Director of Human Services said they were adding?
Yeah, thanks for the question, Ted. I think the simplest thing would be for us to get you in quickly a table that basically sums out all of those numbers of those clinicians to make sure we've got the most up-to-date and accurate information. I believe that the numbers we're talking about are being separately contracted between OHA and ODHS.
I can actually add to that if it helps. The 500 number that I talked about, these are contracted staff that are coming in from out of state. Some of them will be deployed to long-term care facilities. We've identified open beds that are currently not staffed. These staff will be helping staff those beds, so more capacity will be available for hospitals to be able to transition those patients that are appropriate for those beds. And the balance of the staff will be deployed to facilities that are having staff shortages due to the surge that we're experiencing, and that's standard across the industry. Everybody is facing that. I hope that helps. Thank you.
Yeah, thank you.
Thank you, Ted. Okay, our next question comes from Lisa Balick with Coin TV. Go ahead, Lisa.
Yes, thank you. I guess my understanding is then at this point, there is no plan at the moment to assist the public in obtaining home COVID tests. Is that correct?
I would say that beyond the White House plan to directly distribute tests, we don't have a state plan to do retail distribution, targeted populations, but there is the White House plan to do general distribution.
So in other words, unless you're going to a hospital or some other facility, those 12 million tests then would not be accessible to you.
Well, the 12 million tests will be accessible to the hundreds of thousands of Oregonians who are in the targeted populations we're talking about needing to be able to reach.
Thank you for the question, Lisa. Our next question comes from Gary Warner with EO Media. Go ahead, Gary. Gary, go ahead with your question. We'll come back to Gary. Next question comes from Rachel Alexander. Rachel, go ahead.
Thanks. This question is for Director Gill. You mentioned that only a few dozen schools in Oregon have closed, but that includes the state's second largest school district, Salem-Keizer, shutting down all schools for a day because they're so short-staffed that the superintendent is teaching math to first graders. I'm wondering what the state plans to do to aid districts with staffing so that we don't continue to see these problems. And then if you think there's a point where the benefits of in-person class are outweighed by kids having a rotating parade of substitute teachers who may not have any teaching experience.
Thank you for that question. Those two questions, I think, do go hand in hand. Where I'd like to start is that our schools in Oregon are experiencing staffing shortages. It's driven by the Omicron variant. It's driven by staff members who are falling ill and need to isolate from community spread or who are quarantining because they've been in close contact with somebody with Omicron. Those circumstances are impacting every industry in Oregon. So if you have tried to go to a restaurant recently, you'll see that some evenings restaurants end up being closed because they're short-staffed. If you are trying to fly somewhere, you'll see that flights are being canceled because airlines are short-staffed. You'll see sporting events rescheduled because our athletes are contracting COVID or becoming close contacts. So this is something that we're experiencing in every industry. It is super challenging in K-12 schools, where for all the reasons I said, our students rely on the consistency of being able to go to school every day, and our families rely on that consistency to be able to go to work every day as well. So we are doing all we can. We have worked with the Teacher Standards and Practices Commission to ensure that schools have more direct pathways to provide other licensed individuals to be able to serve as substitute teachers. These are often people who serve in educational assistant positions within the same district who the students already have relationship with. TSVC and others have done a great job of trying to roll out a number of different efforts to help support schools in keeping staff going. We do have school districts that are frequently, again, trying to close for as short a time as possible to get through the end of a series of quarantines or isolations for staff so that they can reopen in-person instruction again. We do have a website, and we can make sure that you receive that, Rachel, that is around securing and supporting the continuity of instruction in our schools. It has a number of planning guides and supports to help school districts through this time and help families through this time, also ensuring that they receive some of those services even if schools are closed, like availability of school meals.
Thank you, Director Gill. I don't think you really answered the second part of my question, though, about whether there's a point where the benefits of in-person learning are outweighed by kind of this parade of substitute teachers that subdistricts are seeing at this point.
Yeah, thank you. So typically when will be a little bit different from district to district, and this is one of the reasons why we have this decision as a local decision and not a statewide decision. Most school districts do use the same pool of substitute teachers. Now that pool right now is even more limited than we have experienced in the past. So frequently when a school district is bringing substitute teachers in, these are the same substitutes that the students have worked with on previous occasions this school year. So it doesn't typically end up being a parade of a variety of very different people in those positions. But local districts can make that decision if they believe that they are putting too many different people or too many unprepared people in front of students. That's one of the safety decisions that they will make in the decision guide that we provided for them to ensure that they can operate schools safely and in a secure way for our students. There is also the possibility that a school district may at some point during this Omicron surge move to distance learning because they have too many students who are experiencing either a quarantine or an isolation because they are ill. And the school districts are looking at continuity of instruction for all students. So if they have a high percentage of student absenteeism, that makes it difficult to move through the curriculum for all students. So that will depend on school size and the impacts of COVID at that local school district. And they will take all those factors into consideration as they make that decision. Again, their hope is to remain open, and the decision to move to online learning is very low on their list.
Thank you.
Thank you, Rachel. Our next question comes from Gary Warner. Gary, I believe your microphone is fixed. Go ahead.
Yes, I hope so. Can you hear me?
Yes.
Okay, great. There's a lot of statistics that float around. One that caught my eye today, actually two, was the New York Times reports that Oregon has the highest percentage growth of cases over the past 2 weeks of any state in the nation. But it is only 24th in hospitalizations. What do those statistics tell you? And along with that, there are reports that from IHME and others that the infections have peaked in the East and hospitalizations will soon. How can we take advantage of that, maybe with staff or resources, since it looks like we're going to be hitting things at the end of January, beginning of February? And then I've got one other thing after that.
Well, Gary, those numbers tell me that masks work.
Right.
That we're able to minimize our negative outcomes because we've got a relatively high vaccination rate, a relatively high booster rate, and one of the highest rates of mask usage in the country. We're also a couple of weeks behind other behind states that went into the surge earliest. And so as they begin to slow down a little bit, it's not surprising that we move up in the rankings because we're still on a pretty strong uptrend. I don't know, Dr. Sidelinger, would you like to add anything to that?
Thank you, Director Allen. Thank you, Gary, for the question. I do think, to build on what Director Allen said, the surveys that are done by Carnegie Mellon University that ask people to assess the behaviors that they're changing because of the pandemic have shown that Oregonians consistently have high rates of mask usage and have taken precautions, such as limiting indoor gatherings, having less contact with those outside their home when cases go up. That continues to be the case during Omicron, with protective behaviors increasing amongst Oregonians. The disease first took hold on the East Coast, and in many of the Northeast cities and states were hardest hit initially. On the West Coast, we do lag behind, about a week to 2 weeks behind, but that increase in protective behaviors, particularly wearing masks, a high vaccination rate, and a high booster rate that's increasing as more Oregonians roll up their sleeves and get their boosters, will help to reduce the speed of the increase of cases, will help to reduce the speed of the increase of cases that need to be hospitalized, and will help to assure that the staff that we're bringing into the state can assist in providing quality care to everyone. Hospital growth does lag behind case growth, so we watch that very carefully, and we see our hospital rate increasing, but not at the same rate that our case rate was increasing.
Now, last week, OHSU said they thought that it was going to top out hospitalizations at about 1,650. IHME says 3,000. That was the number that OHSU had earlier. Do you have any updates on that? And the last thing I want to say, so you don't have to come back to me, is why, Director Allen, does OHA release death statistics over the past 2 days of 35 and 31 deaths, in which about 2/3 of them are from before 2022, and that's not noted in any of the introductory materials. You have to go down and actually look at the date of each of the people. It makes it seem, to somebody who's looking at it really fast, that a lot of people are dying since yesterday, and that's just bizarre.
Yeah, let me tackle that last one. I think what we've tried to do is be really consistent about releasing information about deaths as we become aware of them. You're right that we have typically done some kind of a blurb as part of the press release indicating that there's a chunk of older deaths, and we maybe need to redouble our efforts to make sure we're doing that. But what we're mainly trying to do is make sure that that data gets out as quickly as possible. And as you observe, it does include the detail of when those deaths were.
Well, I don't think a lot of people, other than perhaps reporters, look at that detail. And if you look at it just on the cover, I think people need context, and I think they need a preamble about what these deaths mean. If 2/3 of them are from, some of them, at least one of them in the last report and one in the report before that, were from 2020, and that is just mind-boggling to me that it would just all be lumped in together and set out as one daily number.
I appreciate that, Gary. Thank you.
Okay.
Great. Thank you, Gary. Okay, our next question.
Erica, let me answer the other part of his
You
question.
bet.
Right.
I will just say our death certificates are continually reviewed, and death certificates that need to be updated or corrected often lag. And so we do include those deaths with the date when we find those. As for forecasts or models, different models take into account different assumptions. We at OHA work with OHSU and Dr. Graven to keep up to date on what we're seeing in other communities, what assumptions we need to put in the model, how Omicron is behaving in other communities, particularly those that are similar to Oregon. And so those assumptions are put into the model, and we feel fairly confident that the hospital peak is representative of what could happen in Oregon. Other models will make different assumptions, assuming that the virus may spread quicker or more people may be hospitalized. We certainly do look at the IHME model as well as other models that are compiled by the CDC, because those models help us in planning. We want to look at what could happen, what could be some of the worst case scenarios, and try to plan to be able to be responsive to that. And if things turn out better, that's great. We'd rather be over-prepared than underprepared and have something unexpected happen.
Thank you, Dr. Sidelinger. And we are trying to be respectful of everyone's time. We do have a hard stop at 3 o'clock today. So our next question will come from KPTV, Simon Gutierrez. Go ahead, Simon.
Yeah, hi there. A question for either Dr. Sidelinger or Pat Allen. Certain hospitals and health systems have been allowing employees to return, or at least we've heard, 5 days after they test positive, even if they have some symptoms, as long as they don't have a fever. From a health standpoint, how is this possibly safe?
Thank you for that question. This is Dean Sidelinger. I'll take that answer. The CDC has released guidance on infection control and return to work for healthcare providers, particularly those in the hospital setting. We know that many workers are impacted by becoming ill with COVID-19, caring for sick relatives, or being exposed. There are contingency plans in place so that if staffing is at a shortage level that could impact the ability to provide quality care, that using testing and other methods to bring those who are asymptomatic after a period of time, wearing masks and using PPE, personal protective equipment, in a consistent way can bring people back to work sooner, do so without raising the risk of spreading COVID to those around them, including their fellow staff members or patients. And so we have linked back to the CDC guidance and our infection control guidance for healthcare facilities and work with them on how they can bring staff safely back to provide quality care for patients without raising the risk of transmission of COVID.
Thank you for that question, Simon. Okay, our next question comes from Lynn Terry with the Oregon Capitol Chronicle. Go ahead, Lynn.
Hi, thanks for taking my question. I have two actually, and I'll try to be really quick. One is on the staffing. Dr. Sidelinger just, excuse me, just said that Oregon wants to be over-prepared. So with all these new people who are coming in, will that be enough? Do you feel confident that Oregon will have enough staff and that hospitals won't have to activate their crisis standards of care? And then I have another question on masks. Should I ask that now or?
Well, let me tackle the first one, Lynn. I would say confident is probably way farther than I'd be willing to go. I think we're doing absolutely everything we think we can to get as much staff as we possibly can. We're also learning more every day about what this surge might look like. You know, it's really matters a lot if there are relatively fewer people in ICUs and relatively more in medical surgical beds that are there for a shorter period of time, which is some of what the emerging data says. So I don't want to try to make any assurances that we're confident we've done what we need to do to avoid that. But I think we've worked really hard together with our hospitals and with our partners in hospital systems and in other parts of the care system to make sure we've given ourselves every shot we can to avoid that.
Okay, sorry, I'm like masking here. Okay, that leads into my second question, which is why doesn't OHA require N95 masks, which are the gold standard that's very well known in hospitals, healthcare workers, and in schools? I know that that CDC has not come up with that guidance, but why can't OHA on its own, enforce N95s, which would be much more protective?
Thank you for that question, Lynn. This is Dean Sidelinger. I'll take the answer. N95 masks are fit tested for our healthcare workers to ensure that they work. And those are recommended in aerosol generating procedures and certain other procedures for our healthcare workers to wear. That provides protection for the individual, as well as it can be source control if that individual is sick and doesn't know it, and will protect the patients and staff around them. We have recommendations for PPE, including masks, eye protection, and gowns in some cases for healthcare workers in other settings that aren't aerosol generating, that provide protection to the individual and again, prevent spread to those around them. In general community settings, including in schools, I stand by two rules and I add kind of a third corollary. Find a mask that's a quality mask. 2 or more layers is best. Find a mask that fits well above the nose, below the chin, and snugly across the cheeks. And lastly, that should be comfortable because you want to wear it consistently when you're in public places and not be fidgeting with it or pulling it off your face because you're uncomfortable. Certainly a respirator type mask like a KN95 or KF94 can be a quality mask, but does it fit well and is it comfortable? Wearing a surgical mask underneath a cloth mask provides quality filtration, and that cloth mask over the surgical mask improves the fit. And in many community settings, including schools, provides very good protection to the individual, as well as source control, keeping the virus particles in if that person is sick and happens to be in that environment. So look at the masks you have available to you. Find the highest quality mask you can, ensure that it fits well, that you're wearing it consistently, so it needs to be comfortable. If you're in a higher risk setting where you're enclosed with individuals in a very close space for a long period of time and you're at risk, you may choose to use a higher quality mask during that time, even if it's less comfortable. But assess the risk of the situation, but really assess the quality of your mask and the fit of your mask, and those will help keep you and your loved ones that you return to and those around you safe from Omicron.
Thank you, Dr. Sidelinger. Our next question comes from Amy Green, the Oregonian. Go ahead, Amy.
Thank you. This is for Director Gill. In the Portland area, we're now up to 1 out of 5 students as of Friday out because of absences in staff and students. That's about 50,000 students. So this is becoming more of an issue. My question is specifically about sports and extracurriculars. We know that sports in particular can lead to increasing transmission And that can increase the likelihood of in-person learning closures and prolong the time it takes to get back into the classroom. So I'm hearing districts, or at least Portland Public Schools, when I talk to them, saying we specifically want to hear from ODE. If they have an opinion, if they have guidance on this, we want them to be clear. Can you answer this question? What is ODE and your position? What are your positions on whether to hold extracurriculars and pick particular sports during this high-risk time when schools may be forced into remote learning, or to hold extracurriculars and sports when schools already have been forced into remote learning? Should it be allowed? Will ODE take a position on that?
Yeah, thanks for the question. I would say that ODE has taken a position in partnership with the Oregon Health Authority when we released the school health advisory at the beginning of January. So we made it clear that from our perspective, the guidance would be around any activities that the school hosts that look different than the school day, that they either pause those activities during the Omicron surge, and then recognizing the incredible value that those activities also bring to our students, they could continue with those activities if they implemented the same kind of layered mitigation protocols that they have in place during the school day. Okay. So that includes masking, that includes making sure that the places are ventilated, making sure that you have physical distancing. So this is a lot of protections, both for the players and for the audience in that setting. If they can do those protocols, if they can implement those kinds of protocols, then we think that the value of allowing students to continue their lives, even if a school can't manage because of staffing shortages to operate during the school day, if they can manage to operate after school activities in a safe, effective way that helps prevent spread, but also gives students access to those extracurricular activities that are sometimes the thing that encourages a student to come to school day after day and helps them in a number of different ways. We think that still is of value. We just think that you need to make sure that you're implementing those health and safety protocols.
Yeah, just to be clear, so it's okay for sports to continue even if the classrooms are closed, as long as they have mitigation strategies, correct?
As long as they have mitigation strategies, that is okay. And I would say, again, there's a lot of local decision making there. So, that's really dependent on that it's not the same staff that are impacted, that they really do have the staff to continue to operate those extracurricular activities in a safe way. Again, local knowledge and decision making comes into play around when a school closes and what all kinds of activities need to close with that.
Thank you.
Thank you, Amy. Our next question comes from Joyce Kim with KVAL. Go ahead, Joyce. Joyce, are you there?
Okay. Hello. So I had a question for an epidemiologist about the trends in COVID infections, because we are seeing some reports of regions now declining after a purported peak in cases. And I was wondering if someone could talk about what this means for Oregon and the expectations moving forward.
Thank you for that question. This is Dean Sidelinger. What we're seeing now is Oregon is still experiencing high case numbers each day, and hospitalization numbers of folks with COVID are increasing. We're still on the upward trend of the Omicron surge, but when we look at other countries, such as South Africa and some countries in Europe, when we look at some of our East Coast neighbors, particularly in the Northeast, we're starting to see that the areas that were first hit by Omicron have started to come down, countries like South Africa, the UK, other countries in Europe, and some of our East Coast neighbors that were hit later are starting to plateau and even showing signs that their cases will start to come down. We know that that is in our future here in Oregon, but it's not happening right now. For now, the activities we're taking, wearing our masks, getting vaccinated and boosting, can help to slow that rise a little bit, can help to make sure that peak doesn't peak as high as it would, but we're still several weeks away from seeing cases come down. So epidemiologically, we're behind the East Coast by about a week or two. We're behind some of our European neighbors by 2 to 3 weeks, but seeing what's happening in those communities gives us hope that we will get through this in a fairly short period of time. But we need everyone to take those actions to protect themselves and their neighbors, to protect their broader community, because that's what's going to allow our healthcare system to get through this without needing to take additional measures like instituting crisis care guidelines.
Thank you so much. And I also observed that you guys were saying that the test will be mostly going towards hospitals, schools, and community-based programs, along with organizations for agricultural workers and homelessness. And for the agricultural workers and homelessness, those could be hard to regulate. And I was wondering what the strategy was in sending test kits into those areas, along with hospitals and schools.
Thank you for that. We know that some of our migrant and seasonal farm workers and agricultural workers have been hard hit throughout this pandemic. We've worked very hard with community-based organizations who have relationships with these workers, who are trusted by these workers and are in the community, to offer them education and advice, to get them vaccinated, and to get them access to testing throughout this pandemic. We would work with those same providers and partners to help get test kits into the community so that they can be utilized by these individuals to make decisions about protecting themselves and their families. Similar to our homeless providers, our shelters and our organizations that serve the homeless know that this population has been impacted, and particularly when they're sheltered in group settings, that this virus can spread rather quickly. So working with the community-based organizations that are on the ground that have the relationships already will allow us to get tests to these individuals much more readily than building up a new program. We have amazing community partners, healthcare partners, faith-based organizations throughout Oregon that have deep-rooted connections to the community and are trusted by the community. They've been the trusted voices in delivering health messages, in delivering vaccinations, and in getting people linked up to testing. So we're going to continue to use those strategies.
Perfect. Thank you so much.
Thank you, Joyce, and thank you, Dr. Sidelinger. We have one more question. We have time for one more. Anthony with KGW, thank you for waiting. Go ahead.
No problem. Thanks. I wanted to ask a question about kind of immunocompromised and the most vulnerable people, which would basically just be for Pat Allen or for Dr. Sidelinger. What would your advice be right now for people like the ones who have been isolated, who are vaccinated, but they've been doing everything right, so to speak, but they're immunocompromised or otherwise vulnerable, and so they have to take this really seriously. Are there mental health resources available for them? And I mean, some of this would be mask distribution, but what other steps is Oregon taking to make sure that those people don't get lost in the fray of the conversation about Omicron right now?
Thank you for that question. This is Dean Sidelinger. Right now, folks who are immunocompromised, we encourage them to be up to date with their vaccinations. This includes completing their primary series, receiving an extra dose of vaccination, and receiving a booster after that. For individuals who are at risk for complications, being up to date with vaccinations, including their primary series and boosters, offer the best protection. Wearing masks correctly and consistently when outside their home around others, in crowded outdoor places and in all indoor locations can help. But considering changing plans and limiting those activities now during a time when COVID is surging throughout our community is probably a safer bet. So if you're in one of those categories, immunocompromised, at risk for serious illness, or live with someone who's in those categories, rethinking your plans now, limiting your connections with those outside the home where you can, wearing masks consistently and being vaccinated or boosted are going to offer great protections. Staying connected with friends and loved ones is extremely important. We have great technological means that while they don't make up for the physical touch of another individual, a hug or sitting across from someone and talking to them can help keep that connection. If you go to the OHA website, Safe Strong Oregon, that will give some other clues about keeping in touch with others, keeping connected to others, and access to things that you can do during this time that causes increased anxiety and fear, particularly in those most vulnerable, because we know being socially connected, being mentally fit is as important as being physically fit, and all of these things come together, and they've had truly devastating consequences from this pandemic.
Thank you very much. Thank you for the question. That's all the time that we have for today. I want to thank all of our experts and our guests for making the time. We want to be sensitive of everyone's time. For our media partners out there, as you know, our email address has remained the same. You can reach us with the OR COVID Media inbox account, and one of us will get back to you. A copy of this news conference will be included in today's daily media release, as well as the talking points and video of tests actually being loaded to go out as well. So email us with any follow-up questions. And again, thank you for your time, everyone. Have a wonderful afternoon. Take care.